Okay. There's been more recent updated applications of cognitive therapy. We also call it the third wave, mindfulness and acceptance-based therapies. Regardless of its mindfulness or acceptance-based, they come from Buddhist traditions. The goal here or the focus here is really that there's full engagement in reflecting on the self in a very non-confrontational way. We're not going to engage in any avoidance behaviors, and the individual then therefore engage in acceptance, right? And when we really think about what mindfulness is, it's really to attend to the present moment without making any judgments on ourselves or maybe even wishing that things are different. And really, mindfulness, according to Buddhist traditions, is that we all have an innate capacity to deliberately pay full attention to where we are in any given moment, to pay attention to our actual experiences and learn from it, right? But a lot of times as humans, especially in a fast-paced society, we kind of are often living on automatic pilot, and we're not always paying attention to ourselves, our experiences, our thoughts, our moods, and emotions. So for just a short definition of mindfulness is really just awareness of our present experiences with full acceptance, right? And so that's what we want to gain from that. And when we're talking about full engagement, both mindfulness and acceptance, because I want to go back to this, both of these really promote full engagement in a non-confrontational way. Mindfulness is just a way to sit within your present, but not, again, to try to confront it or judge it or to start to deliberate and wishing things were differently. Let me go into the detail of urge surfing here. It really is an approach to the treatment of more like addictive behaviors. It really is an approach for those who have substance abuse behaviors or any other addictive and compulsive behaviors. And this is where if a client is struggling with some unwanted urges, then urge surfing really encourages a client to sort of relate those urges differently than they've ever had before. So you want to pay attention to the urge, pay attention to the experience, and then now pay attention to what differences you'd like those urges to sort of take on, right? To come up with a different experience about those urges than they've ever had before. Okay, acceptance and commitment-based therapies is really accepting your internal psychological experiences. We have fear and ACT. So with fear is really an acronym that underlines our psychological illnesses: fusion, evaluation, avoidance, and reason giving. Fusion, evaluation, avoidance, and reason giving. So I'm going to go over those very briefly, right? So with fusion, we want to fuse together our inner experiences, such as our thoughts and feelings and sensations. We want to fuse all those together. Evaluation really is of the self, especially our own inner experiences. Then we have avoidance. So let's take a look at avoidance. We want to avoid those unpleasant inner experiences, such as, distracting or numbing ourselves, right? And then finally, reason giving. Reason giving is very important. Here's where a much stronger sense of our cognition comes into place. Here is really reason giving, or learning, leaning too heavily on rationalizations that sound very legitimate, but actually perpetuate unhealthy approaches to life. So paying attention to those cognitions that maybe sound reasonably rational, but in actuality actually promote an unhealthy experience. Now, when it comes to ACT, accepting, choosing, and taking action, one of the leaders in this is Stephen Hayes. And again, this is where we just want to be accepting of our own inner experiences, no matter what they are. We're going to be non-judgmental. We're going to take a look at ourselves, take a look at who we are. We're going to reflect on an understanding of that and not try to beat ourselves up, right? And not judge ourselves. Choose a new path, choose a new direction in our life, based on our values. And maybe we have to reevaluate our values and really make new choices for the values that we want to adopt. And of course, to take action, whether it's large or small, it doesn't matter. You want to take these actions that are consistent with our values. So we've got to choose, our core values, and we're going to choose the direction of our life based on that and take action based on those values. So they have to have some coordination. Another mindfulness and acceptance-based therapy is dialectical behavioral therapy, which was originally developed for persons with borderline personality disorder and also with persons who had suicide ideation, suicidality, maybe even those who have self-injurious behaviors as well. There are core practices that are central to DBT, which is problem solving, validation, and dialectics, right? So when we really think about DBT, dialectical behavioral therapy, DBT itself is, dialectical, when we say that term, is really the ability to view issues from multiple perspectives. And this is why it was built for persons with borderline personality disorder. Persons with BBT have difficulty with seeing various layers of themselves. They have difficulty looking at the perspective of other people's experiences as well. They tend to sort of focus on themselves and only understand their experiences and have a very black and white way of viewing the world. And so what dialectical behavioral therapy does, it really helps these folks to really kind of understand these multi-layered experiences and that people have different perspectives other than their own. And their goal is to really arrive at some reconciliation, which, of this like contradictories of like, but I understand the world as X. And then the therapist's goal using DBT is saying, okay, but you need to also understand the world and understand the world of others as A, B, C, D, and E, and not only from the framework of just X. Now, there are 4 different specific frameworks within dialectical behavioral therapy. Mindfulness, we just went over that. Emotion regulation, really identifying and describing and accepting, their negative emotions rather than maybe even avoiding them. So really regulating your emotions. Distress tolerance, emphasizing the development of self-soothing techniques. Impulse control as well, managing any impulse control as well. And then interpersonal effectiveness. Now, the one thing about, DBT and especially how it was developed were persons with borderline personality disorder who have consistent history of having difficulties in their interpersonal relationships with other people because of their inability to kind of understand another person's perspective other than their own. So really helping a person with interpersonal effectiveness can help them really understand sort of better social skills, how to preserve relationships. Persons with borderline personality disorder tend to lose a lot of relationships as well. Friendships, romantic relationships, relationships with siblings, family members, etc. So really the goal there is to help them to preserve relationships that might otherwise be damaged by, these extreme emotional outbursts or extreme intensity with different emotions. Now, here's an interesting thing. Dialectical behavioral therapy is now being utilized and used pretty frequently, more often for even youth and adolescents who are really trying to manage and cope with a lot of psychosocial stressors and a lot of struggling with intensity of their emotions. Now, we're not saying that adolescents therefore have borderline personality disorder, but they certainly have some intensity of emotions that they may be struggling to contend with and how to manage, especially if they have many, many psychosocial stressors. So DBT is known right now, and just starting to look at research in this as well, is known to sort of like minimize the risk factors for psychopathology in adolescents if we start to apply it when adolescents are having a lot of stress situations. Okay, metacognitive therapies is another form or an alternative form of cognitive therapy based on mindfulness and acceptance. The idea that there's an activating event can be a cognition itself. And so it's not any external occurrences that are causing sort of this irrationality, but really simply that the actual, the person's own thoughts make a person psychologically unwell. There doesn't have to be a precipitating event. In fact, the event itself is the actual cognition that kind of creates, the person's own thoughts that create the person to become psychologically unwell. CAS is cognitive attentional syndrome, is really a person that has sort of this brooding, ruminative, problematic thinking styles. So they're not maybe even a catastrophizing thinking style. We looked at that before. It can be both positive and negative thoughts, but either way, both can be very troublesome. And someone, has a more of a CAS attitude or frame of thinking, they can have positive thoughts. In other words, worrying is good because worrying will help me prepare to the future. And if I don't worry, then I won't be blindsided by something. And so I can't stop worrying because otherwise bad things might happen because I need to pay attention. But then that's not very helpful at all, right? They could still be very maladaptive. But then, you can also have negative ways of looking at this as well. Oh no, I'm starting to worry. And once I start, I'm never going to be able to stop. And now I'm going to have terrible, terrible days because I already know it's going to happen. And, I already know I'm going to worry. And this is going to be completely out of my control. So again, this, cognitive attentional syndrome, these like brooding ruminative thoughts can be positive, negative, but either way, both can be problematic. Now, cognitive therapy has actually been shown in research to be very useful for people with different medical problems. So when a person has some medical problems or some diagnosis, it really causes a lot of distress, maybe even anxiety disorders like OCD, PTSD, generalized anxiety disorder, right? That can manifest or emerge just from being diagnosed with some type of medical problems, maybe even having a chronic headache. You don't have to have a significant medical problem. Some people do, maybe a traumatic brain injury or spinal cord injury, but for some people who have maybe like chronic pain or chronic headache, just the anticipation of the experience from a negative light can really start to be problematic and cause different anxiety disorders. So cognitive therapy can be very useful for people with medical issues as well. And research has been found that it's very actually supportive and very effective. Okay, schema therapy is another form of therapy also intended for persons with borderline personality disorder or some other long-standing complex clinical issues as well. It's based on the idea that when young children experience things like poor parenting, they tend to develop schemas. Like schemas are ideas and the ways that we cognitively make sense of the world around us. So, if you've had like a really difficult childhood, you have these deep-seated cognitions about yourselves and about any relationships that you might have with others, and then those can be maladaptive, that we have these schemas. Schemas again are these scripts, these organized cognitive scripts, and the way that we understand the world, how we make sense of the world around us, and how we understand ourselves within the world around us. And so can be very helpful, again, with people who have these difficult histories, especially those that are kind of dealing with long-term depression, maybe even complex eating disorders, and really attention is paid, to the root of the problematic cognitions that may have happened very, very early on with these original schemas that happened from early childhood. Finally, how well does this work? Cognitive therapy is strongly supported by the empirical evidence. Not only does it empirically research and has great evidence, but it also works for a range of disorders, from personality disorders to anxiety disorders to various, eating disorders and even depression and many, many others. Not only that, there's been a lot of improvements provided by cognitive therapists, not only with, improving the quality of lives, but also, physical and psychological variables as well, that extend far beyond symptom relief of the actual targeted, maladaptive cognitions, irrational thoughts as well. And so really the goal is, as a person's rational beliefs increase, so does the chances of their psychological problems drop, and so does the improvement of their overall quality of life. Also, the research on mindfulness-based therapies has come through as well, positive effects for very specific problems such as eating disorders, even psychosis and weight loss. Okay, that's it. That's our lecture slides or our screen recording for cognitive therapy.